Hello, I am Benjamin Segal, and I'm the Chair of Neurology and Director of the Neuroscience Research Institute at The Ohio State University Wexner Medical Center. As a practicing neurologist, I'm gratified by the incredible advances that have been made in my field over the past 20 years. Doctors and scientists have developed new drugs that prevent disability in people with a broad range of neurological diseases and that attenuate neurological symptoms such as weakness, numbness, pain, visual loss, and cognitive decline. An important example of this success involves the treatment of the most common cause of multiple sclerosis, relapsing remitting MS. Relapsing remitting MS is characterized by recurrent episodes of neurologic dysfunction, separated by periods of clinical stability. When I was a young doctor in training, there was nothing we could do to modify the course of relapsing remitting MS. Now, there are over 15 drugs that reduce the frequency of MS attacks, some by over 80%. This is truly a remarkable feat. However, we as neurologists still face considerable challenges in the clinic. Once severe neurologic damage occurs and is fixed, such as following traumatic brain injury or stroke, we have no way to repair it or to restore lost strength, vision, and sensation. In addition, when a neurologic disease is progressive and involves a relentless loss of neurological function and skills, such as in people with Alzheimer's disease, Parkinson's disease, and Lou Gehrig's disease, we don't know how to halt, let alone reverse, the downward spiral. Let me tell you about one of my first patients as a board-certified neurologist. Teresa is a very intelligent woman who was working as a carpenter when I met her. She had noticed decreased strength in her right hand while using some of her tools. She would also develop a right foot drop at the end of a long day. I diagnosed Teresa with a relatively rare form of MS called progressive MS that, unfortunately, does not respond to any of the drugs we now use in relapsing remitting MS. Within a few years, Teresa lost complete use of her right hand and started using a cane. She had to retire prematurely. Now, over 20 years later, she is mostly wheelchair-bound. One of my and my colleagues' greatest ambitions is to discover regenerative treatments that reclaim lost neurological functions and that will improve the prognosis for people like Teresa to the same extent that we are able to do so for people with relapsing or remitting MS at present. This is no easy task. The central nervous system, which includes the brain, spinal cord, and optic nerves, is less resilient and more resistant to repair than other organs. Unlike skin or liver cells, nerve cells do not replicate in adults. Once they die, they cannot be replaced. In addition, severed nerve fibers in the central nervous system do not regrow. Therefore, I was very excited when I read about a possible link between a particular type of inflammatory response and regeneration of the damaged optic nerve in mice. The optic nerve transmits visual signals that originate in the back of the eye, in the retina, to the brain. When the optic nerve is crushed, it normally does not regrow, and all of the nerve cells connected to it die. However, some scientists found, inadvertently, that when they injected a particular inflammation-triggering substance into the back of the eye of mice, then crushed optic nerve fibers regrew. This was truly an unprecedented finding. However, no one had uncovered the reason why this regeneration was happening. They had not identified the type of inflammatory cell that was driving this repair response, let alone discovered how these inflammatory cells worked. My lab and I decided to tackle those questions. First, we carefully analyzed the cells that accumulated in the back of the eye following injection of the inflammation-triggering substance. To our surprise, we discovered a completely new type of cell. This new cell falls into the general category of white blood cells called neutrophils. Neutrophils are the most populous white blood cell in the human circulation. They are the first responders to infections and other threats to the body. However, the new cells that we discovered in association with nerve regeneration were not garden variety neutrophils. In the first place, they were immature or stuck at an early stage of development. Normally, immature neutrophils are only found in the bone marrow, which is the site where all white blood cells develop. Ordinarily, neutrophils do not enter the blood or other tissues until they are fully mature. Therefore, it was surprising that we found immature neutrophils at the site of nervous system injury. In addition, unlike garden variety neutrophils, these unique immature neutrophils express molecules associated with wound healing. They produce growth factors, substances that rescue dying nerve cells and that stimulate new nerve fiber growth. In fact, when we isolated these immature neutrophils from the back of the eyes of mice and put them in a dish with nerve cells, they directly stimulated the nerve cells to grow new fibers. When we injected these immature neutrophils in mice adjacent to sites of spinal cord injury, they stimulated nerve fiber regeneration up the spinal cord. Furthermore, we identified a human neutrophil-like cell line that resembles our mouse regenerative neutrophils, and these cells stimulated human brain cells to grow nerve fibers in a dish. At present, we are investigating here at the Wexner Medical Center whether the immature regenerative neutrophils are therapeutically beneficial in animal models of stroke, progressive MS, ALS, and other neurological conditions. We are also developing methods to trigger the generation of pro-regenerative protective neutrophils from bone marrow cells in a dish. Our long-term goal is to remove human bone marrow cells, which can be done safely, and to trigger them to acquire pro-regenerative nerve protective properties while in a dish, and then re-infuse them into patients with MS, brain and spinal cord trauma, ALS, and even Alzheimer's disease, with the intention that they will stimulate repair in the central nervous system and allow individuals like Teresa to reclaim lost neurological functions and skills so that they could live more independent, satisfying lives. As we continue this work, we are grateful for the support of the Wexner medical community, knowing you are a significant reason we are able to have ambitious goals, to attempt to find cures for these incredibly debilitating and life-altering conditions. Thank you for your attention.